My name is Danica Todd. I am a licensed massage therapist and a Arvigo Techniques of Maya abdominal massage practitioner. And today we're going to take a look at 3 examples of how your daily activity can affect your pelvic and reproductive health. So for our first example, we're going to look at what happens when you tilt your hip. For our slide, we're going to use an image of a mom holding her baby on her hip. This could also look like holding your laundry hamper on your hip. Basically anything that you can balance so that you can use your other hand one-handed on boxes, anything like that. So what I would like for you to take a look at is this image that I have of a pregnant belly. So you see that we have the spine, and in this round gray area is the uterus. And you can see the round ligaments on each side. So in this first slide, you can see that those round ligaments are nice and even, and the uterus is right where it needs to be. Now, in this next slide, what you see is a shortening of the ligament on your left and a lengthening of the ligament on your right. And then in the slide, it shows you where the pain pattern will show up in your body. So if you're watching this and you're pregnant right now and you have pain in the areas that are red, this is probably because your uterus is centered or balanced. And this also can look like when somebody looks at your belly and says, oh wow, your baby's really leaning to one side or the other. And then what happens when it leans to one side is that your piriformis muscle in your glutes have to tighten to balance out that weight. So in this next slide, you can see where the pain will show up as a spasm in one side and a pain in the hip on the other. For our second look, we're going to look at what happens when you wear high heels. So high heels, as an example, is going to tilt your pelvis forward in what we would call an anterior tilt. So when this happens, the first slide you'll see is of a pregnant woman. The image on your right has the baby in an optimal position with the uterus in an optimal position. And then the image on the left shows how the baby is kind of hanging forward and over the belly. This can happen in any pregnancy, but it becomes more and more common with each subsequent pregnancy that you have, because if you don't heal and correct a diastasis, and you don't strengthen your core and your abdomen after you have a baby, the next time you get pregnant, it's not as strong, and then it's easier for the belly to fall forward, the uterus to fall forward. So the next slide, you can see an anatomy picture, and I just put this in because I wanted you to see the round ligament here as well. That round ligament is what we were looking at earlier that was shortened on one side and then lengthened. And then I wanted you to see what does it look like for your back. So if you're pregnant and you're not having back pain, most likely your uterus is in an optimal position. But look at this next slide. See how the red pain area is in the back? And that's because those back muscles, those ligaments, are being pulled because you're not carrying your baby optimally with gravity, and so your body is having to make up for it. And again, just another slide, just so you can see what happens to those muscles when your uterus is falling forward. And then for our final slide, we're going to look at what happens when you're reclining. So I want you to think slouching in the couch, slouching on a recliner, leaning against your headboard to read in bed or watch TV in bed, or even the bad posture we have when we're driving around in the car. So this would cause what we would call a posterior tilt. So if you look at the next slide, what I wanted you to see in this slide can happen to your uterus. This is, and what I find when I work with people, this tilt is the one that is more common, although I see both tilts happening. This posterior tilt, what you see is that then it begins to press on the colon. So this can show up in things like constipation. It can show up in constipation or pencil-like stool when you're menstruating only, because the weight of the uterus doubles and the size doubles when you're menstruating, and this can put pressure on your colon. Back pain when you are having PMS or on your period, and back labor potentially when you're pregnant. And then if you have hemorrhoids from the pregnancy from pushing, you can have a hard time having the hemorrhoids clear up afterwards, because you still have that tension going on, and then you just perpetuate the hemorrhoids constantly postpartum after the baby. And again, this next slide, again showing just an image of what it would look like if the uterus was back, just falling backwards from posture. Going into this mama. This mama is representing what an OP baby looks like. You might have heard the term sunny side up. So sunny side up, it's hard for the baby to articulate underneath the pubic bone. It's possible to have a vaginal delivery, but it is common for those deliveries to be long and hard, and for the pushing to take hours. So I hope that this little short video helped define a little bit of the reasons why you want to get body work and you want to do some self-care to take care of yourself. There are many other things that could be going on in your reproduction system, including fibroids, cysts, polycystic ovary syndrome. There's lots of other things. So if you have any questions, I would encourage you to schedule your free 15-minute consultation now, and let's see if this work is something that can help you get yourself back to balance, back to wellness faster.